A college student came into the ER with a textbook case of appendicitis. He needed immediate surgery, as the procedure is much safer and simpler before the appendix ruptures. He called his parents to inform them, but they told him to decline the operation since he had an important test later that week and they didn't want him to miss it. Despite our warnings about the potential for a ruptured appendix leading to death, he left the ER against medical advice. About 10 hours later, after his appendix ruptured, he returned for emergency surgery. The situation ended up doubling his hospital stay. A patient scheduled for breast surgery in the morning was supposed to have fasted for 8 hours beforehand. During the operation, she vomited what can only be described as a nearly intact, partially digested full English breakfast. It included visible pieces of sausage, eggs, beans, and possibly black pudding, which she aspirated into her unprotected airway. Although we managed to stop most of it from entering her lungs, she required high dependency unit care for a day to recover from the damage caused by stomach acid. My grandfather was the patient in this case. After being told, "Come straight back if you experience chest pain," he didn't return. The result? A blood clot reached his brain. He suffered 3 strokes, a brain hemorrhage, and 2 additional minor strokes. This left him with a paralyzed left arm and right foot, as well as Broca's aphasia. Before all this, he was a man in his late 70s with an old-fashioned mindset. He worked as a school crossing guard, grew his own vegetables, fed birds, built furniture, biked 6 miles on weekends, walked everywhere, and even played darts despite having terrible eyesight because he'd memorized the dartboard layout. Now he lives in a care home and is unable to speak. Has his stubbornness diminished? Not at all. He refuses to do rehabilitation, which could significantly improve his speech because he feels using communication cards is demeaning. As a result, we're left trying to interpret his eyebrow movements to figure out what he's attempting to say. One of these days, I swear, I'll shake him until his teeth rattle. The same goes for his brothers. My uncle, his younger sibling, avoided going to the hospital entirely and was eventually discovered whimpering on his bedroom floor with full-blown sepsis. When I was the assistant manager at a group home, we had a resident who suffered from epilepsy and was very withdrawn. He disliked anyone entering his room or even knocking on his door, becoming agitated when we did. However, the rules required us to check on him every 30 minutes due to his seizure risk. This wasn't being followed, so I raised the issue with the manager. She acknowledged it, but said bending the rules was acceptable since the checks upset him so much. Although I felt uneasy about her response, I was young and assumed she knew best. When I was on shift, I stuck to the 30-minute checks, even though he'd shout at me, but I didn't let it get to me. About 6 months later, after I'd transferred to another group home, he had a seizure while alone in his room and was found dead a day later. That experience changed me. Now, if I spot a similar problem, I don't let anyone convince me to drop it. Never again. Rest in peace, D. You're missed, but never forgotten. As a nurse, I once cared for a kind and polite patient who, after a motorcycle accident, was trying to pull out every chest tube and IV line in sight. He was clearly delirious from a combination of pain medication and a head injury, but he remained incredibly pleasant. During my lunch break, just 10 minutes in, I saw him stumble past the break room door like something straight out of The Walking Dead, leaving a trail of blood behind him before collapsing unconscious moments later. He'd been trying to get to the bathroom. I still have no idea how he managed to pull out his chest tubes, which always make me cringe even under normal circumstances. We got him back into bed, this time in the ICU, and sedated him further. Although tearing out his tubes set back his recovery by a few weeks, he eventually got discharged. On his way out, he stopped by to thank us and say goodbye. Despite everything, he was the happiest delirious patient I've ever met. What a tough guy. Absolutely unforgettable. I'm not a medical professional, but a patient who got a serious scare from her doctor. After my second C-section, my surgeon had to leave before I was discharged, so another surgeon handled my release instructions. He'd just returned from restitching a woman's abdomen because she had picked up her 5-year-old on the day she left the hospital. He made it very clear that I wasn't to lift anything heavier than 8 pounds, or stand while holding anything, or else we'd have a problem. His warnings were terrifying, but I could tell he meant it. He'd had to push that woman's organs back inside her body while her terrified child was standing there, covered in her blood. So, for 2 weeks, I didn't lift anything heavier than my baby. As instructed, he also made sure my husband understood that there'd be no sex and not even a mention of it for 3 months. A throat cancer patient once declined surgery we offered to remove his tumor, which would have been a fairly minimal procedure. He said he didn't want to endure what he considered a disfiguring surgery. Instead, he chose to rely on his daughter-in-law, who had been studying magnet therapy and, according to him, was really skilled at it. A year later, he returned, but by then his cancer had progressed so far that no treatment options were left. At the animal hospital, at least once a week, we have to restitch spay incisions because owners refuse to keep the protective cone on their dog or cat. They let their pets tear up the surgical site, exposing their organs. I can't stress this enough. Keep the cone on. I don't care how sad Luna looks with it. Then, the same owners yell at us when they have to pay for sedation and restitching. It's incredibly frustrating. Although he didn't die, a young man just 20 years old lost an eye because of complications from severe diabetic retinopathy caused by poorly managed type 1 diabetes. After undergoing eye surgery to remove blood and scar tissue, we instructed him to take it easy for a few weeks. Instead, he went to Six Flags. Roller coasters and his condition didn't mix well. His retina detached entirely, his eye became soft and painful, and it ultimately had to be removed. During medical school, I encountered a man in his late 60s who came in complaining of chest pain. It turned out he was having a severe heart attack, a significant STEMI in the LAD, confirmed via EKG. He refused an urgent cardiac catheterization, a procedure involving threading a stent through the arteries to open a blocked heart vessel, because he wanted to drive his car home first and then return to the hospital by ambulance. His reasoning? Parking at the ramp cost $20 per day. Unfortunately, he came back by ambulance in full cardiac arrest, no pulse, and passed away. The doctor had to inform his son, who responded, "Yeah, that sounds like Dad. He was always so frugal." At the ER where I volunteer, I overheard a heated exchange. Doctor, "Sir, I'm warning you, don't touch the knife. It could cut an artery." Patient, shouting while removing the knife. Doctor, "Damn it! Angie, grab more gauze." Chaotic shouting ensues and security walks past. Patient, yelling. Doctor, "Why did you put it back in?" The patient had removed the knife, causing significant bleeding, and amidst the shouting match, stabbed himself again in the exact spot. A mother in the NICU constantly kissed her premature baby on the mouth despite repeated warnings from nurses about the risks. The nurses, thankfully, documented these discussions. This occurred during cold and flu season, and concerns grew when the mother began showing symptoms of illness, including sneezing, coughing, and visible congestion. Despite this, she continued kissing the baby on the lips. The baby, who was almost ready to be discharged, became gravely ill, requiring a ventilator and an extended hospital stay with numerous close calls. This story isn't about a patient, but about the caregivers at a facility for adults with mental illnesses. I used to visit various board and lodge facilities to help clients manage their mental health, arrange therapy sessions, set up job interviews, and organize their weekly medications if needed. These facilities were meant for individuals transitioning from hospitals who were considered independent enough to live in dorm-style arrangements with minimal supervision. While this setup worked for some, others who were more unstable often fell through the cracks. For instance, one man with paranoid schizophrenia, who was quiet and withdrawn, seemed to be deteriorating in mood and appearance. Upon noticing he frequently missed his medications, I alerted the staff and his doctor, suggesting they monitor him closely. I was assured that he would be reminded of his housing agreement, given 30 days to comply, and potentially sent back to the hospital. None of this happened. Instead, the man acquired a knife and attacked his roommate while he slept, slashing him from mouth to ear and stabbing him multiple times in the stomach. Though the roommate survived, the incident left him physically scarred and exacerbated his PTSD. Meanwhile, the attacker, believing he was being poisoned through the window AC unit, is now unlikely ever to find another rehabilitation facility due to his violent record. This failure in the system devastated both men, one scarred physically and emotionally, and the other unable to recover within the current system. I'm not a doctor, but here's my story. I got bitten by something but didn't see what it was. Thinking it was a hornet sting, I ignored it, though the area kept spreading, itching, and feeling hot and painful. At the time, I was in college on my mom's insurance, so I called her to say I thought I needed to see a doctor. She dismissed it, saying, "Tough it out, it's just a bee sting." Eventually, I went to the doctor anyway, and found out it was infected, spreading into my lymphatic system, and most likely caused by a black widow spider.